Today we're joined with President Jonathan Nez of Navajo Nation. Early in the pandemic, the Navajo Nation experienced one of the highest coronavirus positive rates in the world. Much of the nation continued to lack essential services such as running water, electricity, and refrigeration to store medication. President Jonathan Nez joins us to discuss his government's coronavirus response alongside the U.S. government. So, President Nez, Indigenous communities have experienced some of the highest coronavirus positive rates in the world. What is the coronavirus situation like in the areas that the Navajo Indian Health Reserves operates? What has the severity been like? What is the death toll? And in general, what has been your coronavirus response plan?
Well, thank you for having us on the show. We have tested 64,579 of our Navajo citizens. As you may know, we have 350,000 Navajos, or people who identified themselves as Navajo, during the 2010 U.S. Census count. Around half of our citizens live on the Navajo Nation. So based on our aggressive testing, we have tested over 30% of our people here on the Navajo Nation. Since the start of the pandemic, we have had 8,243 of our citizens contract the virus. Okay. And we are also tracking our recovery numbers. And that amount is 5,866. And these are data as of yesterday at 5 p.m. from our epidemiology team. Sadly, we have lost 401 of our Navajo citizens to the virus, and our thoughts and our prayers go out to the families. We, as leaders, Vice President Myron Lizer and myself, surrounded ourselves with healthcare professionals, doctors and nurses, experts, and you hear that all the way to Washington, D.C. in the Center for Disease Control. And so right off, we took these recommendations of wearing masks, social distancing, washing hands, and staying home seriously. And we even went as far as placing those recommendations into our public health emergency orders, where we mandated our citizens to wear masks in public back in mid-April. And we also did some stringent public health orders, like shutting our nation down weekdays from 8 p.m. to 5 a.m. And we're currently still doing lockdowns. We just got done with a 57-hour weekend curfew. We have reinstated that. We actually stopped that for 2 weeks because of our drop in numbers, but because of the surrounding states peaking in cases, we felt that we should reinstate that 57-hour curfew. And we also are doing checkpoints and roadblocks here on our nation to make sure people are at home during these curfews, these lockdowns. And our visitors, we're not locking down our nation to our visitors because we are a large nation, 27,000 square miles of land, equivalent to the size of West Virginia. So it's going to be difficult with the limited resources we have to shut down the roads, because interstate commerce and people do need to get from one place to another, and we don't want any people to be stopped during an emergency. you got to listen to the healthcare professionals. I wish that the federal government leaders there would do the same, and even our states around us. Studies have shown that wearing masks slow down the spread of COVID-19. And because of these very stringent public health orders here on the Navajo Nation, people don't want to be told what to do, but bold leaders need to put those in place for the health and the well-being of our citizens. And it took some time for our Navajo people to get used to these new requirements. But now they have accepted it. People wear masks. If you come to the nation, 90+% of our people are wearing masks. There's no pushback. There's no people protesting about masks, because they recognize that helped slow down the spread of COVID-19 here on the Navajo Nation.
And in terms of the CARES Act funding that the United States was supposed to provide, have you received that? And what was the timeline for how you were receiving those? Because I know there was some issue getting those in the beginning.
Yeah, there's a lot of frustration throughout this country, especially tribal leaders. $8 billion was set aside for tribes, but there was an interpretation that half of that money should go to the Alaska Native corporations, which the lower 48 states, their tribes have stated no. These monies were intended specifically for tribal members and for the relief from this virus. And so we had to wait 3 months now, 3 months for the allocation of CARES Act. And it took a lawsuit against the federal government and Department of Treasury to make sure that we get our share of COVID-19 monies, relief monies to the nation. While the rest of the the rest of the other states, cities and municipalities got their money right away. But tribes had to wait 3 months. And when we got our money, we were starting to flatten out. So if the federal government tries to take credit for them saying that on the Navajo Nation, it was because of them that the cases went down, I don't think so. We did everything in our power to help each other out, but don't get me wrong, we appreciate the money, and that's what we're talking about right now. But with the first allocation of monies to all the tribes, it took 3 months, and that was only 60% of the allocation, the $8 billion allocation. Just 3 weeks ago, we got the rest of the 40%. And for the Navajo Nation, we received $714+ million of CARES Act relief, and out of $8 billion. And so right now we're in a dialogue with our leadership to begin to plan on ways to expend these dollars. And we did already expend $62 million for immediate needs, to clean our buildings, to also get testing. Now we're in a lockdown right now, so we're preparing to reopen the Navajo Nation government. In order for us to do that, we got to clean some of these buildings that were compromised by COVID positive individuals. And we also have to clean and start to begin to reconfigure our office space based on social distancing. And also purchasing personal protection equipment, gloves, masks, cleaning supplies for our people so that they can transition back into a clean and healthy work environment. And so that's what we're doing right now. The remaining amount is about $660 million plus, and that is what we're wanting to use to get water infrastructure and agriculture, electricity and power lines and solar projects, housing, manufacturing facilities, broadband and telecommunication, even to put some money aside for our people and economic development and those businesses that were hit hard. And, there's so many needs here on the Navajo Nation, don't get me wrong, but these are the ones that are common that have been brought to our attention every so often by the Navajo people. As you know, 30 to 40% of our Navajo people don't have running water. Let's get them running water so that they can combat this virus by washing their hands, or any virus that comes in the future. Electricity, people need refrigeration to store their foods. And if they don't do that, then they have to go to the store ever so often, and puts them into a vulnerable situation, because they can contract the virus if they're out in heavily gathered places like supermarkets or even the hospital. People do have those individuals that are in the most vulnerable population category have to get medicines. And some of our people don't have refrigeration, because some of these medicines need a refrigerator. So they have to go to the hospital every so often. And that, again, puts them into an even greater chance of contracting the virus. And as you're on this video conference today, we need better telecommunication broadband for our people, for telehealth, telework, teleeducation, and even just getting information out to our people. I could go down the list. Yeah, I could go down the list on all of them, but those are just examples of what we've experienced through this pandemic.
So, President Nez, you're using much of the funding from the CARES Act to help build out your nation's healthcare and public assistance infrastructure. How do you plan to use the funding from the CARE Act to also invest in jobs programs to get your people back to work during this time?
Well, here on the Navajo Nation, the largest employers are the Navajo Nation government, the schools, and the hospitals. For the Navajo Nation government, our employees have been on administrative leave for a few months now. So they're getting paid. Some are working from home, but the essential employees are the ones that are on the front lines of this pandemic. Our police officers, our doctors, our nurses, those that are helping out in this public health emergency. So we have also seen that we can actually run a government on a smaller workforce. And so those are things that we're going to be considering as we reopen the Navajo Nation, is restructuring and reorganization of our Navajo government.
Now, as a concluding question, have any remarks to give to our listeners about how they can support the Navajo Nation during this time and other Indigenous groups?
Well, let me just say, too, that we thank the Friends of the Navajo Nation. There have been a lot of donations that have come in, monetary donations, as well as food and supplies. Thank you so much. That is because due to the failure of the federal government for allocating the CARES Act funds immediately. And so thank you so much. I know that many people have said, Navajo Nation president, how can we help? And I think they want to hear we want, food or supplies or something tangible for our people, which is good. But what I've been asking our U.S. citizens and our friends to do is contact their senators, contact their representatives, and let them know that Congress needs to fulfill those promises made between them, the federal government, and the tribes throughout this country. We need better infrastructure. We need to improve the healthcare system here, as well as better education, and many more. 30 to 40% of the Navajo people having no running water is unacceptable in the most powerful country in the world. We need to change that. So to your question, Sai, what can people do? Contact their congressmen, contact their representatives, tell them to approve the HEROES Act, which will allocate money for infrastructure, continue to let our lawmakers know that they need to take a better care of the first citizens of this country, the Navajo people, as well as the 573 other tribes in the United States of America.
Thank you, President Nez. We really appreciate you taking the time to come on the program and to share your thoughts. It was truly an honor to speak with you.